Hey there. Today we're going to talk about something that looks kind of wild but is actually super common and totally harmless: geographic tongue. So, have you ever looked in the mirror and seen these weird map-like patterns on your tongue? It can definitely be a "what is going on" moment. But trust me, you're not alone. It's way more common than you'd think. So, what's the deal?
Okay, so first things first. What even is this map on your tongue?
Okay, let's get the most important stuff out of the way right now. This condition is completely harmless. It's not cancerous, seriously. The fancy medical name is benign migratory glossitis, which sounds intense, but it basically tells you everything you need to know. Benign means harmless, and migratory, well, that means it moves around. It happens because the tiny little bumps on your tongue, called papillae, just kind of disappear for a little while in those spots.
All right, so if it's not dangerous, the next big question is, why? Why does this even happen in the first place?
And this is where it gets a little tricky. The truth is, nobody knows for sure. There isn't one single thing that causes it. It's still a bit of a medical mystery. But researchers have figured out there are several things that seem to be linked to it. Yeah, it really looks like a mix of different things. For one, it can run in families, so genetics definitely play a part. Big surprise, right? Stress and hormonal changes, like during pregnancy, are also huge triggers. And sometimes it can be tied to other things going on in your body, like not getting enough of certain vitamins, having allergies, or even other conditions like psoriasis or diabetes.
Okay, so we know what it is and some potential causes, but what does it actually look and feel like when you have a flare-up?
Well, the most obvious part is what you see, right? These smooth red patches that usually have a white or yellowish-looking border around them. And that migratory part we talked about, it's for real. The pattern can literally change shape and move to a different spot on your tongue, sometimes in just a few hours. For a lot of people, it's totally painless, but some do get a mild burning feeling or find their tongue is extra sensitive to certain foods. All right, let's get practical. If it's bugging you, what can you actually do about it? How do you manage a flare-up and get some relief?
Okay, this is key. For most people, you don't actually need any kind of medical treatment. The goal here isn't to cure it because it's not a disease. It's all about managing any discomfort you might feel.
So managing it really comes down to two simple things: avoiding stuff that irritates it and picking up some helpful habits. On the avoid list, we've got the usual suspects: super spicy foods, really acidic things like tomatoes or oranges, and foods that are either piping hot or ice cold. On the helpful side, just keeping up with good oral hygiene, finding ways to chill out and manage stress, and eating a healthy, balanced diet can make a huge difference.
So let's boil this down to 4 simple steps you can take. Number 1, manage your stress. It's a huge trigger, so find what works for you. 2, eat a balanced diet. This helps make sure you're not missing any key nutrients. 3, become a detective. Pay attention and figure out your personal food triggers. And 4, keep up with your regular dental checkups. It's always a good idea to make sure everything else in your mouth is healthy.
Okay, now for the rapid-fire round. Let's tackle the biggest questions people have when they see this.
First up, and this is a big one: is it contagious?
Let's be super clear on this. No, absolutely not. It is not contagious. It's an inflammatory thing, not an infection. You can't give it to someone by kissing or sharing a drink, so you can totally relax about that. All right, now for the question that's probably in the back of everyone's mind. Is there any link to cancer?
And again, the answer is a huge, resounding no. Geographic tongue is a benign condition. That means it is not cancer. It's not precancerous, and it doesn't increase your risk of getting oral cancer down the line. Period.
So what's the deal long term? Does it ever just go away for good?
Well, for a lot of folks, it can come and go. You might have a flare-up, and then your tongue will look totally normal for weeks, months, or even years. Then, poof, a patch might show up again. But yeah, it often clears up completely on its own without you doing a thing. And this quote really sums it all up perfectly. While it might feel a little weird or uncomfortable sometimes, at its core, geographic tongue is a benign condition that very rarely needs a doctor's attention. So, at the end of the day, what's the most important thing to take away from all this? It's pretty simple. Understanding what this is takes away the fear. Once you know it's harmless, it stops being this scary, unknown thing and just becomes a manageable little quirk. So, instead of seeing it as a medical problem, maybe just think of it as one of your body's weird but totally harmless party tricks.